Ladies and gentlemen, thank you very much for gathering on a public holiday. My name is Kamoshida Naoaki. I'm Director for International Press Division of the Ministry of Foreign Affairs, and I today serve as a moderator for this press conference. Today we have speakers from members of expert meeting on the novel coronavirus disease control. First, Dr. Shigeru, Chief Director of the Japan Community Healthcare Organization. And secondly, Dr. OHMAGARI Norio, Director, Department of Infectious Diseases, National Center for Global Health and Medicine Disease Control and Prevention Center. And also we have one speaker from the Ministry of Health, Labor and Welfare, Mr. Kita Yosuke, a Senior Coordinator for Global Health Corporation, International Affairs Division of the Ministry. Today's press conference is given on the record, so you can vote with the name and title of the speakers. After some introductory remarks, we will take questions from the floor. And when you ask questions, please use the microphone and specify your name and affiliation when you ask a question. So, without further ado, I would like to invite first Mr. Kita to make some introductory remarks.
Hello, my name is Yosuke Kita, Senior Coordinator for Global Health in International Division of Ministry of Health, Labor and Welfare in Japan. Today I'd like to explain this updated EpiCard as I distributed you. So this one we already showed to the public this EpiCard, but we've all updated the data on a day-by-day basis. So basically, this explanation is that based on the average incubation period for 5 to 7 days of coronavirus infection, new coronavirus infection, we had the peak of onset of fever on February 7th. That means that we start the isolation, cabin-based isolation from February 5th, at the morning of February 5th. That means that we see the peak of the fever 7th of February. That means that our analysis by National Institute of Infectious Disease and Hokkaido University, that we concluded that our isolation, especially for passengers, are effective. But unfortunately, to maintain the daily life of the more than 300 and around 700 passengers crews, we need to help. We need to the support from crew members to maintain the daily life. So that means that among the crew members, we cannot isolate them completely. So that means that we can observe the we can observe the onset of crew members after the isolation period after February 5th. As you see in the pictures, the blue bar depicts the fever onset of crew members. I cannot exactly say the peak is on the 11th of February or 13th of February, but that means among the cruise ship members, after the isolation of the passengers, they can be infected. They could be infected among crew members. But after the analysis of this kind of EpiCard, we concluded that balancing out of the human rights of being isolated on the ship and scientific analysis on this EpiCard, we decided to release the passengers who has the three conditions, which is no symptoms, and got the negative PCR test, and no close contact. We released them on the 19th of February. So that's it for my explanation. Thank you.
Thank you, Mr. Ekman. Dr. Moore, do you have something to add?
Oh, well, I may supplement what Dr. Kita mentioned with regard to this graph. You know, this graph, epi curve is, I like to emphasize, this is by date of onset. And many people may assume that recently every day new cases occurring day after day. That is not correct. My role is to put the correct picture to the international community. As a matter of fact, all the passengers, more than 3,700, all the passengers was on board for 2 weeks. 2 weeks before the captain was alerted on the risk of the infection. Then 5th of February, that's the date that the isolation practice was put in place officially. Then for the actually, if I simplify the issue, passengers was on board almost 2 weeks. The 5th of February, coincidentally, is the middle of this period. The first 2 weeks, obviously passengers get on board for social enjoyment, movie watching, dining, dancing, sometimes mahjong. So for 2 weeks, first 2 weeks, the distance between each other was very close. Mahjong, dining. So this first 2 weeks is the period majority of the infection took place. Then afterward, the policy was put in place. I admit, isolation policy was not perfect. Ship was not designed for hospital. Ship was a ship. Ship is not hospital. Of course, isolation is not ideal as expected from the hospital. So, in my view, although isolation was somehow effective to a large extent, it was not perfect. But if you look at this, as Dr. Kita mentioned, the peak of the patient who had onset of the 7th of February, that's the highest peak, is only 2 days after the 5th. And you know that the incubation period, on average 10 days, depends upon. So if you use our epidemiological common sense, this 7th case, infection took place before that's a common sense. And ideally speaking, if the isolation were perfect, 6 plus 10 is a 15, isn't it? Let's suppose the 10 days, of course, 14 days, 10 days, it's still, it's being revised. For simplified, let's assume that the incubation is period 10 days. Then, if the isolation practice were perfect, in theory, you will not have any cases who has an onset on 15 or on afterward, right? But if you look at this one, there are some cases, 15, 16, particularly red one, blue one. So it's indication that the isolation was not necessarily perfect, but somehow it was effective to a large extent. That is the accurate picture. Of course, this number analyzed is a very, how many number total? Was, so it does not pick up all the cases.
199.
190. Of course, there are some, but this 190 was not arbitrarily selected. And if you assume, usually, Dr. Kita, you have to correct me if I'm wrong. Of course, there are, there's the Ministry of Health has information as to when the infection was confirmed. And by and large, I think that on average, 3 or 4, it takes 3 or 4 days for the confirmation to take place. So if you use this kind of figure, you can assume that on average, 3 days prior to the confirmation date is the date that the infection took place. So if you take into account that kind of information, the total trend does not change. So this is so of course this is not epidemiological statistically 100% correct, but this overall, what does this graph shows overall trend is that the majority of infection took place before the isolation, but afterward isolation took place. It was effective to some degree, but not perfect. That is the analysis of our technical committee members. So that is just a supplementary the comment to what he said. Thank you.
Thank you, Dr. Omi. Now, I'd like to take questions from the floor, but let me take questions from some of you in the group, and I will ask experts to answer your questions. And please use your microphone and indicate your name and affiliation when you ask a question.
Thank you, Richard Lloyd Parry, The Times. The purpose of quarantine, as I understand it, is to prevent people who are already infected from infecting other people, and also to allow you to identify people who are not infected, because after 14 days, if they're not showing symptoms, you can assume they're clear. So at the end of 14 days, if quarantine has worked, you have some clarity, right? Surely it's obvious to everyone that this quarantine was a complete failure in that way. This quarantine of the Diamond Princess was a complete failure because at the end of 14 days, those foreign passengers who have gone home have had to do another 14 days of quarantine. And the judgment that that was necessary has been shown to be quite accurate because a number of them have been proved positive, having been declared negative in Japan. The Japanese passengers who were allowed to walk off the ship onto trains and buses, at least one of them is positive. So surely, by any measure, this quarantine has failed, has it not?
Well,
please answer. Yeah.
Well, I think what the point that you are getting at is very important. The person who tested negative on the boat showed some symptom and developed disease after disembarkation, right? So that is there are some cases like this. I think Australian gentleman was I think one of the example, right? So what does it mean? I have to put this one into overall. Of course, we are very. I think it's a very fortunate that I feel very sympathetic of this gentleman. Yes. Now, those person who tested negative does not guarantee that this person is not infected, meaning that this person is free of virus because of several reasons. I'm not a virus, but you have to correct me. Couple of reasons are there. Well, number one is the sensitivity of the test. You see, sensitivity. What level you will pick up? It's not 100% the sensitive. So now it's a technical limitation. All tests, have this kind of technical limitation in terms of sensitivity. Second one is it also depends on the timing when the sample was collected. As you see, this disease, incubation period, by and large, generally speaking, as the symptoms become very serious, more virus expression. So if you test the test during the first the phase of the incubation period, some virus may not be present, or even if present very little. So it also detection is dependent upon the timing of the sample collection. So these are the variables which you explain why. Then the incubation period, the reset thing in U.S. like proposed reset, because the position of U.S. is Japan's quarantine is imperfect. So why you have to restart from the beginning, from the scratch? That's the point. I understand rationale behind it. But now, again, I like to put this one into the overall perspective. Remember that those people from Wuhan who returned from the China by chartered flight. I'm sure that you gentlemen remember that. That one, those passengers put in the what you call Mikazuki hotel, right? Hotel, where the isolation was more perfect. I mean, no place is perfect except the hospital. More